and I'm the EMS Chief here at Austin Travis County EMS. Thank you for joining us today. We've got a pretty important topic that we want to cover. We've seen an increase, what we consider a serious increase in the number of cases involving the use of synthetic marijuana in our community, better known as K2. At this stage, we have not seen any fatalities from the use of K2 in our community, but we're not ruling that possibility out. And part of the reason that we wanted to talk to you and talk to our community about the use of K2 and what we're seeing in our community is to keep as many people safe and as possible away from using K2. So at this stage, Emergency Medical Services has responded to 31 patients in the last 3 days. We think that's the tip of the iceberg. We think there's a lot of other people out there who are experiencing signs and symptoms following the use of K2 that are not calling 911 or that are going directly to the hospitals. The hospitals are also seeing an increase in the use of K2 as well. We don't know exactly what those numbers are, but most of the time, whenever you have a situation like this, the number of cases that you see happening in EMS are the tip of the iceberg compared to what all the hospitals and other medical facilities are seeing in a community. So we suspect that the number that we've seen, 31 in 3 days, is just the tip of the iceberg. We also have seen a change in the way that K2 is affecting the folks in our community, and I've got some experts here that are going to talk to you today as well. Dr. Paul Hinchy, our physician medical director, is going to talk to you about some of the signs and symptoms and how it impacts the body and some of the dangers that are involved with K2. And we also have Lieutenant Pat Connor with the APD Organized Crime Unit here to answer questions in case you've got additional questions about K2. So some of the signs and symptoms that we have seen with the use of K2 can be very dangerous. One of the ones that we see right now, we're seeing elevated temperatures, we're seeing seizures, we're seeing people having blackouts. We've got some folks experiencing violent behavior, very aggressive tendencies. We have some that are experiencing paranoia and anxiety, chest pain, increased heart rate, and most recently, with the most recent batch of the use of K2, we're seeing people with an extremely low heart rate and extremely low blood pressure. That can be a deadly combination, and we wanted to warn our community that that's what we're seeing here. So with that, I'd like to call Dr. Hinchy up and let him talk to you a little bit about signs and symptoms and how this is happening. Thanks.
So my name's Paul Hinchy, Hinchey is my last name, and I'm the medical director for the Austin Travis County EMS system. So as Chief Rodriguez was pointing out, we've seen an increase in the utilization of, or the community use of K2. Chief Rodriguez described a variety of the symptoms that come with the use of K2. Some of that is because we don't actually know what all is being put in this product that people are consuming. People make the mistake of thinking that a synthetic marijuana of this nature is a safe drug, and it's analogous to marijuana. We don't actually know what's being introduced into these agents. So there's talk of bug spray and adulterated with all kinds of chemicals of convenience, and we don't know what they are. So we've seen a change in the behavior of the drug in terms of what the signs and symptoms look like. We typically see the agitation, the elevated temperatures, the high heart rate, high blood pressure. It's been associated with things like strokes and kidney failure and obviously cardiac arrest. We've seen a new transition. Again, we don't know what's caused this transition to the bradycardia, the slower heart rate, the low blood pressure. We don't know what's been added to the agent to create those effects. We have advised the crews of the change in presentation just so they're aware and know to suspect a potential toxic ingestion and to be able to treat supportively whenever possible. Other than that, there is no direct therapy for the agent. We can only treat it for the life-threatening components and the symptoms that it presents with. So with that, do we have, Chief, you want to?
Sure. I think one of the key things that we wanted to point out about the use of K2 is the feeling that some people think that these are overdoses of K2. That's not what we're talking about here. We're talking about an ordinary use of K2. This is not a drug that you can predict. If you've had it once before and you use it again, that doesn't mean that it's going to be safe and that you're going to survive it. Our job is to be out here protecting our community. And we're seeing large numbers of use of this particular drug, and it's having detrimental effects. We've had very, very serious cases that have occurred. When you have a person that responds with violence, that puts our crews into danger, and we don't want to have that happen to us. When we have people that are responding with a low blood pressure and a low pulse, their lives are in danger, and we need to step in and take care of that. One of the best things that we believe we can do is let everybody know the truth about this marijuana, artificial as it is, and that it is not a natural substance. It is not what you find out in the run-of-the-mill community. This is something that's being manufactured. There's absolutely no idea, no way to know what is being added to this and what kind of response your body's going to have to it. So what we're doing is trying to inform our community, educate as many people as possible about the dangers related to the use of K2, and try to divert people from using that if at all possible. I think the takeaway points from this are the composition of synthetic marijuana is unknown. We don't know what it is from batch to batch. That's an important takeaway. If somebody used this drug before and then they use it again at a different time, it is not the same drug that they used before. So you can't develop an experiential sense of the use of this drug. The other is you don't know what you're putting into your body. Like Dr. Hinchy said, it could be anything from bug spray to all sorts of chemicals, and those things are deadly for a human body. So if a person is out there, you know somebody that's using this or contemplating using it, stay away from it. Make the right choice. It's deadly, potentially deadly. So we're trying to drive as many people away from that. So at this point, we'd like to open up for questions. Again, we got Dr. Hinchy here with our medical director's office. We got Lieutenant Pat Connor with the organized crime unit, and myself as well, available to answer any questions you may have.
Why take this instead of marijuana? I'll stand over here so you can look at the camera. Sorry, I don't know who can answer that.
You have a...
Or why not just do crack? I mean, why take this drug? What's so great about it?
So my understanding, there's at least the perception that this is readily available, it's much lower cost, and there's the belief that this is just like marijuana. So it has that same use profile. So if you can get it and it's cheap, it's perceived as a better alternative. But as the chief pointed out, we don't know how it's going to respond for each person each time. So your first use could be deadly.
Who's taking this? And where are you seeing this the most? I know Captain Benavides talked about a lot of this is in the downtown corridor. Can you talk about the intersection of who is most affected by this?
It's really difficult to try to develop an idea of the group of people that are using this right now. It seems to be a broad range of people. I personally ran on a case a few weeks ago. It was an older woman who was lethargic. We found her laying out on the street. That was the only sign that we had. Most of these cases are coming out in the downtown area. We don't know why. I don't know if that's an availability issue or if that's just where we're hearing about it the most. But that's what we know about it at this point.
For those folks that will be watching this that aren't drug users or don't know anything about the drug scene, can you tell me about the trickle-down effect of having a widespread issue or an issue with K2 use as far as crime rate and what happens? I mean, you said that it's, puts your crews in danger as well. Does it put the average Joe walking into HEB in danger?
I don't know that there's that kind of a danger. We have seen some cases involving violent persons that respond in a violent nature. The point is that K2 has got agents in it that could have an impact on a person's central nervous system. With that come behavioral changes and physical changes, and it's unpredictable. And that's about all that we know about that drug. The problem that we're seeing is that the different signs and symptoms are so widespread, it's hard to pin them down. I don't know if our police department has any other views about it.
To add on to that, I think an important piece of this is that every different batch of K2 is some different chemical. So what somebody might have today thought was okay, they buy the same batch tomorrow and it was made at a different time at a different location. So therefore it's got different chemicals in it that you're going to react to totally different. So it's just an unknown chemical that you're ingesting. And that's the most important thing. You're taking a chemical. I mean, we've got information that the people are putting Raid bug spray on it. I mean, things like that where people are willingly smoking Raid bug spray.
Well, I mean, or is there like a central, I know you can't talk about, you know, the investigation part of this, but I mean, is there like one person that's making this whole batch of, I mean, can I go home and make a batch of synthetic marijuana? How do you do this?
I mean, essentially, it's like a potpourri, and then they're lacing it or treating it with different chemical compounds to give that high or that effect to it. There's not a central person here in Austin that's manufacturing that we know of. I mean, we have several active investigations ongoing. I think a big piece of it is in Texas, we've been short on the legislation for us to have for enforcement purposes, which Senate Bill 172 was passed and signed off, which should go into effect September 1st, which will greatly help us in our investigative side. And I think another piece of part of a question that was asked earlier about why are people using it, there's a perception that there's nothing illegal about having it. There's certain pieces of K2 that are illegal in Texas right now, but pretty much every type of it's illegal federally. So there is legislation out there that can be used for enforcement purposes, but that's not that's designed to be used for a small, you know, a user that's got a small amount. That's not something that we would even the AUSA would not be prosecuting a user for having a small amount. That's more for the person that's the high-level dealer, the person that's importing it, manufacturing it, distributing it, because there's actually a distribution system that's used for it, because there's a perception from a lot of people that it's not illegal.
Is the perception that it's cheap, you can make it at home, you get the same high as weed, and you're not going to be busted walking around with it? Is that why?
Well, most of the people aren't making it home. This is manufactured, whether it's imported or it's manufactured in other locations and packaged and shipped here or transported here to Austin, where you have people that are selling it, and then they have the bulk of the people that we're seeing out on the street. It's not one of those. It's not so much of a storefront thing that you're able to walk into a convenience store and buy. This is normally sold on the street level dealer selling it by the individual cigarette, and that's even more concerning, because above and beyond that packaging that it's sold in, you know, commercially or through a distributor, that's been treated or sealed at their level. Once it gets to the point that it gets out on the street, whoever that in-level dealer is that's selling it on the street is taking it out of that package, and information we're getting is that it's at times being retreated with unknown chemicals or substances, and then those people are actually individually rolling it into a stick or into a cigarette and selling those cigarettes individually to the end user. So the end user's not even getting it in the original package or packaging that it was made in. And that, on our end, that makes it a lot more difficult when we have these overdose type situations. Is the person says, I smoked K2, but they just had a cigarette, and maybe they smoked it 25, 30 feet away. They had a seizure or some type of episode. That cigarette's gone. They don't have the packaging on them that it came in. And so for us, it's very difficult to even try and figure out or recreate what type of chemical they may have ingested. We've, you know, if they had the packet, every time we've had a packet that's been seized, we've actually, you know, saved it. We've sent it off to labs for testing to try and figure out what this elusive chemical is that we're trying to chase.
Can someone talk about, is there a reason that we're now seeing this change? I mean, what happened? Why are we now seeing this increase?
I think from talking to officers and from what we've seen, the K2's been out there. It's for years you've seen it, but for some reason there's this trend or way now that they're starting to treat it to get this bigger high, maybe going for that synthetic, you know, the hydroponic, the stronger weed high, or high, just whatever it is, they're trying to compete to get that better high. And so people are pushing the envelope or whatever it is to try and make that K2 that's stronger and more a better high.
Did we have some deaths this year or last year? I thought we had some K2 deaths.
We haven't had any not that we know of, no.
Confirmed fatalities as a result of K2 usage. Now, does this K2 show up on a drug test? Because I've heard that a lot of people are smoking it because it doesn't show on their drug tests.
The problem is you don't know what they're putting in it to get you high. So you may think it's not going to come up on a drug test, but did they lace it with PCP? PCP is going to show up on a drug test. So that's the thing, is that we don't know what they're putting in it, so we don't know what it's testing positive for. It could be testing positive. They could be putting methamphetamine on it. They could be putting cocaine in it. So there's no telling what you're smoking. People are buying an unknown substance packaged by an unknown person with the intent to get high. So you don't know what you're ingesting. So I wouldn't say that you're going to, not test positive on a drug test just because you thought you smoked synthetic marijuana.
Can you go over again, what is APD doing about it? It is legal. I'm confused about the legality.
And currently in state law, there are just a small amount of analogs or chemical compounds of the K2 that are illegal in the state of Texas. However, there is federal legislation that is more encompassing and has a much larger range of chemicals, a large quantity of chemicals that are included, which we're actively working with the U.S. Attorney's Office and the DEA on investigations trying to determine the whereabouts and where it's coming from.
And there haven't been any fatalities in Austin, but can it be fatal?
Yes.
Although we have not seen any fatalities, confirmed fatalities, as a direct result of K2 utilization here in Austin Travis County. Nationwide, there are reports of fatalities of people who have perished on a single use, on a single experience with it. So while we haven't seen them here, this is a problem that is endemic across the country.
I think someone else asked it, and I'm not sure, it doesn't matter who answers it, but how does this trickle down to the rest of the community? How does this impact the rest of Austin?
Well, I think one of the important things is awareness. We want everybody to understand what K2 is and what it is not. K2 is not marijuana. It is an assortment of substances that are mixed together by unknown persons. And I think about it as the equivalent of walking down the pesticide aisle, picking something, and putting it in your body. You don't know what's in it. The other thing is that this, as I said before, this is not an overdose situation. This can be a single dose situation. A person could be contemplating experimenting with drugs and thinking that K2 might be a safe alternative. It is not. So we want everybody in our community to know that. And we want it to be something that's discussed at the dinner table. We want everybody to look at their teens in the eyes and say, this is not a safe drug. It is dangerous. It can kill you. And we want that type of frank discussion to be occurring long before emergency medical services has to respond to take care of somebody whose life is now in danger.
Is the time of year significant, the fact that it's summer?
Well, I have an opinion about that, but I don't have any data behind that. I do believe that the rising temperatures are going to have an impact, and that we may see more cases of use during the summer. Number one, because summertime is a recreational period, and there's just more people around. As more people begin to congregate throughout our community, people who are dealers looking to make profit on this are going to make themselves more available. And then our bodies tend to react differently with high temperatures around us. So I think all those factors are going to come together, and we're going to see an increase that's coming. And as Commander Benavides said, there are cases where people have died from the use of that. It has not happened in our community, and we don't want it to. So that's why we're taking this proactive step to try to inform our community about the dangers of K2.
Can it be addictive? I guess it's made up of different chemicals. We never know, but does it have the same addictive principle?
We have no idea whether there's an addictive side to this or not.
I know you said there's a broad range of people using it, but are you seeing a majority of teens and young adults that it appeals more to?
We're kind of seeing everybody right now. We've got middle-aged persons, we've got young persons. Drive downtown, that's the population, and that's what we're seeing. I think it's just broadly available right now. And I think anybody who is, maybe they've had a little party in time, maybe they've had a little bit of alcohol ingestion, and they're feeling a little bit safe and not vulnerable, they may try it. They may just take a puff, or they may buy a cigarette. We don't know. But it can be anybody at this stage, and that's why we're talking to everyone about it.
I think to add on to what Chief Rodriguez was mentioning, when it comes to the dangers to the public or public safety was one of the questions. I think Sheldon, you were asking that. A couple things. One, it's the safety to the user. I mean, to make sure. I mean, this is that's a big piece of this. Is we don't want somebody going out there and smoking or ingesting this and potentially dying, having a fatality, or some type of long-lasting medical problem because of this. But on the flip side, we've got first responders, we've got EMS and firefighters and police officers that are going out there to handle these calls. And like we've had multiple situations where the people have turned violent. EMS is showing up to these calls, just it's a person down, and where there may not be an officer there to help try and restrain the person. And the EMS, the paramedics are actually having to try to restrain this person that's violent, and it's putting their lives in danger just to try and go help these guys. So, I mean, I think that's the big piece of the public safety side, is that the public needs to understand that going out there and people using this and smoking this potentially is putting the people that are coming to help you in danger as well. And then some of these people that are using it are having hallucinations and becoming violent. So when you have that combination right there, you end up throwing anybody and everybody out there in the public that's out on the street that interacts with that person potentially could be in a dangerous situation, because you don't know how they're going to react or interact with you. So.
Very good. Thank you so much for joining us today, and we hope that you can help us spread the word about K2 and its dangers, and let's try to prevent any lethal cases that occur in our community, and let's try to keep as many people away from K2 if at all possible. It is a dangerous drug. It doesn't require an overdose. A single dose can cause somebody some very, very serious physical responses, both mental, as in hallucinations. It could be seizures, it could be chest pain. You could die from it. So help us get the word out there, and we really appreciate you being here today. Thank you.